Our job is to try to get what I always call boots on the ground, resources into the community. We create the space for the communities, they step in and do what they need to do to help their own people. The component that's really important, I think, is ceremony or spiritual. Because in my understanding and what I know is that our ancestors, before contact, put down prayers and ceremonies for us to pick up. And whatever that looks like today for the different nations, that's what's going on. They put those down for us, and now our job is to pick them up.
Today, as we navigate the changing currents of our time, we look to the wisdom in our communities to guide our direction. Though we've made progress reclaiming the traditional ways that kept our ancestors healthy for thousands of years, we have more work to do. Climate change has affected our traditional ways of food harvesting. Economic uncertainty has deepened food insecurity in many communities, and too many of us face racism when seeking health care.
We've always looked at things from a holistic perspective. We don't look at things in isolation. So when we talk about the social determinants of health, it's the way in which we see how everything is interconnected and interrelated. And we can't be successful in one area and unsuccessful in another area and live a high quality life.
There is a desire for more participation from chiefs and leaders across the province to give direction to the Health Council, particularly chiefs and leaders from rural and remote communities who face additional barriers.
The chiefs of the day really wanted to make sure that we were creating something new, something that was going to be responsive to community need, and something that was going to be community-driven, nation-based. When we're talking about the structure of the Health Council, now is the time to return to the table and ensure that we're meeting those original objectives that the leadership set for us. What is the mandate? What is the accountability framework? What are the responsibilities? Will really inform the next phase of this work and how we move forward.
What I'm hearing from chiefs and leaders is that it's important that they have those direct connections with ministers and with premiers and the member of parliament, and understanding how they have their mandates, we have ours, and where are they aligning.
In doing this work, that engagement pathway is how we get to see the chiefs and leaders in each community, and we bring them together for that conversation. And we put forward to them the information, we hear from them, we report back to them, we revise it. It's a whole process in itself. The chiefs and leaders are really conscious that we are at this point 10 years into the transfer, and they're looking for transformation. The same old system does not work. We need to transform it. What's the sort of structural and strategic change we need to make?